Good afternoon. I'm Dr. Jazz Atwal. I'm the Acting Deputy Chief Provincial Public Health Officer. Today, we are announcing 10 additional deaths due to COVID-19. We're announcing 5 deaths from Southern Health, Santé Sud Health Region, 1 death from the Prairie Mountain Health Region, 1 from the Interlake Eastern Health Region, and 3 from the Winnipeg Health Region. I want to extend my condolences to the family, the friends, and the caregivers of these individuals announced today. It's never easy to lose a loved one, and to lose a loved one around the holidays and with the restrictions currently in place is especially hard. So today, we're going to announce that the current 5-day COVID-19 test positivity rate is 13.6% provincially, and it's 13.1% in Winnipeg. As of 9:30 a.m. today, there was 350 new cases of the virus that have been identified in Manitoba. The total number of labbed confirmed cases in Manitoba is 22,391. I wanted to start today by giving an update on the contact tracing. We continue to process and make technology improvements to our systems. This includes further updates to our active case information. We're reviewing older cases and closed a number of them to more accurately reflect the fact that people have recovered. We also have been using an auto-dialing system to update cases. This has allowed us to move an additional 1,416 cases from active to recovered. This allows for a more accurate reporting of active cases in the daily bulletin and online. We will continue to look for improvements and improve our case and contact tracing processes over the coming weeks. While our case numbers are getting better, we had 10 deaths today, and our hospitalization and ICU numbers still remain high. Christmas is next week. Holidays are coming. We are all used to getting together at this time of year, traveling and celebrating together. We have all had traditions that we want to continue, but this year is different, and it needs to be different. This year, we need to make sacrifices, and it will be hard. I am discouraging all non-essential travel within and between the province at this time. Connect with family and friends by phone, go online. Travel to and from northern Manitoba is restricted. This also extends to snowbirds who annually travel to the United States for winter. Our messaging remains the same. We need to stay home. We need to practice the fundamentals of staying home when we are sick, washing our hands, and covering our cough and wearing a mask. Go for testing if you experience COVID-19 symptoms. We need to limit our contacts and stick to our households. Only go out for essentials and only send one person. We must all take action together to stop this now. The next 2 weeks are critical, but we know what we need to do to stop the spread of this virus. I can now take questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have 1 preliminary and 2 follow-up questions. Up first this afternoon from CTV Winnipeg, John.
Good afternoon, Doctor. I hope you're well. What can you tell Northern Remote First Nations about when they can expect the vaccine to arrive and who will be considered an at-risk adult?
Yeah, we're working closely on our vaccine rollout. Again, this is we're at the very early stages of our vaccine rollout. When you consider the 900 people that are being vaccinated as we speak by the end of today, if you think of a jigsaw puzzle of 1,600 pieces, that's what Manitoba represents. These 900 vaccines is one piece of that jigsaw puzzle. In fact, you can consider it half a dose because we're recommending a 2-dose regime. We're administering vaccine. We're going to administer it as fast as we can. You know, we are looking at all of our communities. We're looking at where risk is. We're going to focus on where that risk is and prioritize groups based on risk. There's no timetable at the present time. We don't have any more vaccine in Manitoba. There are plans for more and more vaccines to come in, but we're going to have to plan, and that planning process is underway, and we're going to work with our partners to look at that operationalization, the distribution, the inoculations of vaccines for all Manitobans.
Thank you for that. We understand that there will be routine surveillance testing in care homes. Can you explain to us how this will help keep the virus at bay and what limitations these tests have?
Yes, so what we're planning on doing is we're going to do a little bit of a trial here where we're going to be looking at using point-of-care testing, something called a pan-bio device, and we're going to be looking at care homes. We're piloting this in 3 care homes where staff there, when they come to work, are going to be offered on a volunteer basis to do a swab to look for COVID-19. And obviously, if they test positive, we would take those public health measures that are required. This is a pilot project. This is a new tool that we're utilizing, and we're going to look at operationalizing it and piloting it in 3 sites at the present time, and we're going to learn from that. I mean, this will involve what's called asymptomatic screening, following that trial run, we'll have some better information on if the test works, how well it works, and the utility of that test to be rolled out to perhaps other places if it does seem to be of benefit.
What impact you think this could have on staffing levels if there's a large number of probable positive results?
That's a good question. I think we are rolling it out in 3 centers. We're going to quickly get an answer to that question as well. I think with asymptomatic testing we've done in the past, we know our numbers are really low on a percentage basis. Our cases in the communities is dropping day by day, essentially. So again, there might be an impact on the workforce side. We are creating and we have contingencies for that. But at this point, I don't think we're expecting a big issue in relation to that.
Thank you.
From City News, Jonas.
Good afternoon, Dr. Atwal. Nice to meet you over the phone. First question, if you don't mind, is just running through some of the test positive numbers we're seeing still. The rate's still elevated above 13%. What does that tell us, I guess, for what's going on in the community right now?
Yeah, so, we kind of mentioned this the other day. Our test positivity is still a little bit high. We know through sentinel surveillance that other viruses really aren't circulating in Manitoba. Our test volumes are 2,200 tests being run per day. We aren't seeing a lot of other viruses around as well. What we're seeing on a test positivity side, it's likely remaining high because that is the only virus that's circulating. There's a lot of tests being done in outbreak situations, so that sort of increases that test positivity a little bit as well. In general, our case numbers aren't increasing exponentially, right? They are trending in the right direction. It seems that we're heading in the right direction. Test positivity is just one indicator, and I think what we're seeing in general, though, is a less case volume in general within Manitoba.
Thank you for that, sir. As we're heading into Christmas. You talked to folks in your opening remarks saying stay home. I guess if folks are looking at the numbers and saying, hey, it's not as bad as it used to be, that's, I guess, just a message that where we are is no reason to relax.
Yeah, we continue to reinforce that message. I think we have been doing that. We're continuing to that, and we're going to, on an ongoing basis, continue to do that. We want Manitoba to be in a good place in 2021. The risk with this virus is those interactions, right? Interactions between individuals. The more individuals that interact, the greater the risk. There really is no true way of having zero risk. So we want to mitigate that risk as much as possible. Our hospitals, our hospital numbers still remain high. Currently there's 305 active hospitalizations. We have 73 that are recovered for a total of 378 total hospitalizations. We've got 43 active cases in the ICU, 7 that are recovered in the ICU, so that's a total of 50 in the ICU. So our numbers are still high. Our acute care colleagues continuously advise us that it's busy. They are maxed out. Staffing issues will come over the next little bit of time with holidays in different parts of the province, especially in different communities as well on the healthcare side. So we want to be able to manage this as best as we can. And I think the focus needs to be for everyone to stay at home to reduce that risk. Let's have a good start to 2021.
Thanks for that, sir. As the final follow-up, I noticed in the release today there is a new outbreak in Thompson. Can you just tell us what we know about the situation there?
I have not been briefed on the issue in Thompson at this point, and that's something we'd have to get back to you on.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. I was wondering, Dr. Atwal, if you could describe the type of enforcement Manitobans can expect to see over the holiday season, particularly around the rule of household visitors.
Right. So, the orders are there. They are enforceable. We're messaging, we're educating people, we're trusting people, but enforcement is possible. There's a tremendous amount of enforcement officers out there right across the province that have the ability to do this. So again, do what's best, stay at home, don't have visitors over, and let's have a different type of holiday this year to make sure that 2021 we have a good start, and then next year, we need to look forward to next year. We need to focus on that.
Just to follow up on that, so is it possible that if someone has visitors over to their home that they could maybe expect a knock on the door from an enforcement officer or something along those lines?
I mean, that's possible. The orders are there. Again, they are enforceable, right? So, that is possible. And again, it's a tool we have in our toolbox, and I think people need to be aware of that.
Okay, thank you. And I just wanted to follow up on one of your comments about the rate of asymptomatic cases. So the latest data from the province shows about 24% of our total cases have been asymptomatic. Does that number surprise you? And I guess, how should we in the public interpret that figure?
I'd have to look for that number specifically to kind of reference that to see what it means. I mean, we do some asymptomatic testing. We have historically done a lot of asymptomatic testing. There's asymptomatic testing that's involved in outbreaks that we do. Those positivity numbers will be higher. There's sentinel surveillance that we do on individuals. There's asymptomatic testing that we have done in the past, and those numbers are really, really low. So, I think a lot of people who are symptomatic are presenting. The utility of asymptomatic testing is something that we don't promote universally. We use it strategically on the public health side to make sure that tests are being utilized for important reasons where it has an impact, and we're going to continue to focus on that as well.
From Global, Malika.
Hi, Dr. Atwal. Thank you so much for doing this for us. The question relates to the 900 healthcare workers that are going to be completed by today. Have they all been set up? Once they get completed, will they all be set up for their second shot like it was prepared to be done like that? And did any of them suffer any serious side effects?
Yeah, great question. So I know on Wednesday we had 302 doses that were administered. Yesterday was 291 doses or people that had the vaccination. So that was about 593 people in total that received the vaccination at the clinics. At this point, there hasn't been any adverse events. Vaccinations are ongoing this morning as well, and they should conclude later on today for another approximately 300 people. My understanding was that there was a follow-ups being booked for these individuals in 21 days' time, and so that's that.
Okay, perfect. And then I just wanted to ask about contact tracing. I believe you touched on it briefly at the beginning, but are we still behind? How is it going with our contact tracing in the province?
Yeah, great question. I think from a contact tracing side, we're reaching about 2/3 of our cases within a 24-hour period, and we're reaching about 3/4 roughly in about 48 hours. There are it's tough to reach everyone for a variety of reasons, but those numbers are really, really good. We're reaching approximately about 60% of contacts in a 24-hour period and 95% of contacts over a 48-hour period. So, we've seen tremendous improvement in that over the past several weeks. There's been a lot of effort, a concerted effort on public health side, on public health side with nursing, and to get those numbers improved, to make sure that that case and contact investigation is happening timely. So it looks good at this point.
Okay, and then some of the numbers that are coming out over the last couple of days, we've been seeing potentially some younger people around in their 40s, 50s. Today there was a man in his 40s. Can we talk about any underlying conditions at this point? Did he have any underlying conditions?
Yeah, I don't have detailed information on medical history of individuals who have passed away from COVID-19. I'm assuming that's what you're referring to. So I can't answer that question for you right now. Sorry.
Okay, thank you.
From the Brandon Sun, Colin.
Hey, Dr. Atwal. I was wondering if you might be able to provide more details on the asymptomatic surveillance care homes announced yesterday. How soon could we see that be expanded beyond the pilot project?
Yeah, first we're going to do the pilot project. I believe the pilot project will be a 4-week period. And then we're going to assess the program at that point and determine, our next steps in relation to that. So again, 3 sites. I believe it's starting up on the 21st of December. And we're going to do a 4-week stretch of it. And again, look at that data and decide what our next steps are going to be.
So today we had over 300 cases for the first time in about a week. I was just wondering if there's any reason that the province noticed for that jump in daily cases.
Yeah, so great question. Our case numbers are a little bit higher today than we last spoke the other day. Obviously, we have some outbreaks in some First Nations communities, and there was a number of the cases were related to those First Nations communities as well. I think it was about 60 is the number in my head right now. It's not an exact number, so I apologize. And so a part of that number has to do with those outbreaks in those communities.
My final question is one that a reader of ours sent in. If someone picks someone up at the airport in Winnipeg who traveled in from either Eastern Canada or out of the country, does the person driving with them in the car also have to self-isolate along with the traveler from elsewhere?
Yeah, so we have transportation guidelines available online. I mean, realistically, if someone is coming in from out of country or east of Terrace Bay, question first becomes, why are you picking them up? Are you picking them up? They're going to stay at your home and they're going to self-isolate there. Best thing for someone to do is actually take a taxi or some other mode of transport that's not public, obviously, to get to that home. If someone does have to transport that individual from the household, I mean, they can meet them there, but there are precautions that would be required. We recommend rolling down the window and making sure that the passenger puts their own luggage into the car and takes it out. They want to sit in the back seat furthest away from the driver as well. You could roll down the window. It's advisable everyone wears non-medical masks as well. So there are guidelines like this available on our website.
From CJOB, Will.
Good afternoon, Dr. Atwal. So the first round of vaccine doses have been given out and are being given out today. I'm just wondering, have you learned anything unexpected or anything that would change the way vaccines are administered in the future?
We haven't reviewed the process. So it's still underway. This is day 3 of it. So obviously we're going to take a look at the whole process of the booking, and obviously there were some hiccups in the booking, but I believe a lot of that is being worked out right now. From the process of having individuals come into the center, get admitted per se or checked in, having that pre-assessment done, getting the vaccine and that post-assessment, it sounds like everything went really well from an operation side. Again, this was a small scale, still 300 people per day, And obviously, we're going to take a look at all that information and everything that we learned from this. And if there's ways to make it better, we're going to make it better. And obviously, the plan is to scale this up as well. So at this point, it's just more about collecting the information. But again, from what we've heard, it's been a really smooth process.
Okay, thank you for that. Also wondering, what sort of reactions should people expect when they get the vaccine? Maybe not adverse reactions, but what should they expect their body to go through, and how common are these things?
Yeah, so most times when people get a vaccine, they do quite well afterwards. There's really no issues, and same applies to this vaccine. I think in the study group, up to about 10% of people had a mild fever or a slight bit of an irritation of the throat or felt a little bit tired. Again, we gave out just about 600 inoculations as of last night, and no one's had an adverse event that we're aware of at this point. Obviously, something could develop in 24 hours as well, but realistically, I think most people at this point are tolerating it well. Obviously, you feel a bit of a pinch when you get the needle, and beyond that, should have some minor symptoms in a small percentage of people.
Okay, thanks. Final question, changing the topic somewhat. When it comes time to roll back some of the restrictions we're under now, would you expect that to happen region by region, or would the entire province come out of level red in unison?
Great question. Again, we look at what's happening in every region. We look at communities. We look at the epidemiology of the cases, and we review that. And we don't just look at one area. We don't look at one snapshot of things. There's a lot of indicators that we look at. And on an ongoing basis, every day we have these talks. We have these talks every day. We have them every week. And only time will tell. So, as we get closer to when, these orders run out, we'll have a better sense of how restrictions are or what they will look like. And how regions might be treated differently. In the past, again, we have treated regions differently. We have treated health districts differently. And we have treated the whole province the same, especially at this point. So again, there's a lot of different tools that we can use there. There's a lot of different scenarios. I'm not one to guess. We like to follow the evidence, and that's what we're going to do when we look at the orders again.
From the Winnipeg Sun, Scott.
Good afternoon, Dr. Atwal. First question, travel restrictions from the West. The West is having, a tough time with new cases and that sort of thing. People are still allowed to come in, though, from the West without having to self-isolate. Well, you still have to from anywhere east of Terrace Bay. Why are the restrictions still so strict out east, but not out west, even though we're seeing an uptick in cases, especially in Alberta and even in Saskatchewan?
Yeah, great question. I think right across all the provinces, some provinces are more impacted than others. Everyone in public health is saying the same thing, right? They're saying stay at home, don't travel, stay at home for the holidays. We have had changes in epidemiology in different provinces. We had changes in our own epidemiology where, we're really at 0 cases, and over a period of time we graduated up to hundreds of cases. The orders are something that can be used to help, prevent some spread of infection, and that's what we use the orders for. It's hard sometimes changing the orders really fast, week to week, just because one community might have an outbreak versus another. So again, when we look at how travel has impacted cases in Manitoba, we haven't really seen that evidence. The percentage there is really, really low. We haven't seen people bringing infection into Manitoba. There's movement of individuals across all the provinces for jobs, et cetera. We've worked with industry in relation to that as well. And travel risk is considered low. But the message, again, in all provinces is stay at home.
And I can appreciate that. I'm just wondering, if the travel risk is low, why still those eastern restrictions? And, if you look at even flights today or, flights over the last week, people are going to travel, that. People are going to come from the west, from the east, that sort of thing. I guess even for this Christmas period, why not have some sort of isolation restriction to kind of, thwart a risk that is there if people are traveling, back to the province from wherever?
Yeah, we always look at those travel orders as well when the orders need to be renewed. And again, I think the messaging is stay at home, avoid that travel. Again, we will always continue to look at those orders and see what needs to be revised, what needs to be added or taken away. But at this point, again, that messaging is stay at home.
Thanks for that. And just for my final question, there's been talk about potentially an extra 20% of a dose in the Pfizer doses. Is the province looked into that? Whether you can extract an extra dose out of the vial? I know Pfizer is kind of looking into it to see if there's evidence of that. I think the Canadian Public Health Agency of Canada is also doing the same. Has the province looked into that as well?
Yes, so that's something that has been looked into, and we are getting on average 6 doses out of a vial right now. So we are, capitalizing on that, and whether this continues on forever from Pfizer, I'm not too sure what the answer there is. But obviously, we're not wasting any dose. We're giving every dose, and we're going to make sure that we continue to give every dose.
From CBC Radio Canada, Mohammed.
Good afternoon, Dr. Atwal. Mohammed from CBC Radio Canada. I have a question about the Moderna vaccine. Moderna announced this morning that this vaccine can be shipped locally without needing to be frozen at all. How does that make things easier for communities in northern Manitoba, for example?
Yeah, so we knew from the get-go the Moderna vaccine would be, from a logistical side, a little bit easier to manage. It doesn't need the ultra-low freezers of minus 70, minus 80 degrees. It could use like a regular freezer of minus 20 degrees. So that will be taken into account in how we provide that vaccine to Manitobans and where that vaccine would be offered. Again, no final decisions have been made, obviously. We haven't received any Moderna vaccine at the present time. I know there are plans for us to receive those doses. And again, there is that planning underway to look at the different types of vaccines we're getting. So again, we have the Pfizer, it's Health Canada approved, we have it, we're giving it. We're going to look at the Moderna when we get it. Before we even get it, once it's in the air, we're going to have a plan for how that's going to be provided to individuals as well. So these vaccines at first are going to come in small allotments, and we're going to be providing vaccine again as quickly as we can to individuals, and those logistical considerations will be taken into account in where that vaccine will be offered.
Thank you. And my second question, I think you've answered that before, but just to be sure, we see a higher count in northern Manitoba today. Could you tell us if this is the result of targeted testing in your community, and which community?
Yeah, so, there's a lot of communities, with outbreaks within the north. When we look at some of our First Nations communities, 54 out of 63 First Nations communities in Manitoba have had a case of COVID-19 on them. They're not all in the north. Right now, there's 6 communities that have 827 active cases. So that's a lot of cases in small communities of 1,000 to 2,000 people. So a lot of our northern numbers are reflective of that as well. And a lot of work's being done federally in some of the First Nations communities, provincially as well, with other stakeholders to limit the adverse impacts of that for case and contact management, for assessments of individuals, and to ensure that those who require medical attention are getting it. So, a lot of the northern numbers are reflective of the impact that COVID-19 has had in some of these First Nations communities.
Thank you. And my last question, it's about vaccine. All the health workers who get vaccinated are getting back right away to work, or they have to wait for some hours or some days before getting back to work?
Yeah, I believe, as long as they're feeling fine, they are able to return to work. I'd have to just clarify that, but I'm pretty sure they are allowed to return to work. Obviously, if they develop a fever or a symptom, they're going to stay at home and contact their occupational health side. But at this point, my understanding is they are able to go back to work.
Our final reporter this afternoon from CBC Manitoba, Bart.
Hey, Dr. Atwal, just getting back to the north here, what's the epidemiology? We've heard a lot about Shamattawa and a bit about Red Sucker Lake. What's the epidemiology at Buda-Bonaby, also known as Oxford House?
Well, I have some information on those communities. You know, just give me 1 second here. These aren't the most updated numbers, but let's say a community like Shamattawa, you know, we have 340 confirmed cases. Essentially, they're all active. Oxford House has 143 active cases at the present time. I mean, those would be the two most impacted. Red Sucker Lake has hit the news as well, obviously, and at the present time, I believe they're at 59 cases. That doesn't include today's numbers. So I mean, I think some of those numbers will increase after today as well. So that is the impact in those communities. You know, these are small communities. These aren't large communities either. So that is impactful to a community.
Forgive me, perhaps I didn't explain that very well. How is, to the best of public health knowledge, how is it spreading among these communities, and how do you believe it's getting in and out?
Yeah, so in some of in one of the communities, there's just a lot of movement of individuals. You know, the infection came in probably from someone returning from Winnipeg. There was contact of that individual to a number of different households. A lot of these households have overcrowding issues. So when you're dealing with households, some of these households have 10 people in them. So a 1,000 square foot home, you got 10 people. So you could see how quickly virus can spread. So over the course of 2 to 4 weeks time, there's sort of that exponential spread throughout. I mean, that would be the biggest reason in relation to spread within the community.
Okay, and changing topics slightly here, let's say early in the new year, Manitoba receives a significant shipment of COVID-19 vaccine. How soon could you scale up to mass immunizations of your first 4 priority groups?
Right, so we have a bit of an idea how much vaccine is supposed to come, is sort of week by week to some degree. Again, it's a very fluid number. Plans are underway to ensure that whatever vaccine we get will be utilized right away. We're not going to get 100,000 doses one day. We all know that. We know that there's going to be a gradual ramp up by the companies in relation to providing that vaccine and delivering that vaccine. They provided, I believe, sort of an idea of how that vaccine will roll out. And every day that's reviewed. Every single day that's reviewed. And then the plans will change accordingly. So it's a hard question to answer. You're asking me about 2 weeks from now, when at the present time we have a certain amount of vaccine that we're utilizing right now in the province. So again, we'll have more information on a week-to-week basis that we'd be better able to answer that question.
I'm not asking you specifically what date in January. I just mean, let's say you get it, how soon can you ramp up the distribution once you do get it?
So again, I mean, if we're going to receive vaccine right away, we're going to be putting it into arms next week. Right? If you're asking me, can we put 100,000 doses of vaccine into 100,000 different people next week? We aren't prepared for that. But over the course of 10,000 vaccines every week, over a course of 100,000 vaccines coming in a month, we'll be prepared for that, if that happens.
Thanks, everyone. This concludes our media briefing.